Hello and welcome to my channel. This is a case of a patient with a proliferative diabetic retinopathy who has had recurrent hemorrhages, has blood proliferations, and is not really caring for their blood sugar levels properly. So that's an indication for a vitrectomy. This is quite a straightforward case, not a complicated case at all, but it's important to know how to deal with cases where the posterior hyaloid is completely attached. So the first thing I do is just do a slight core vitrectomy and then try to find any area where the vitreous is detached. In this case, there wasn't, so I used triamcinolone in order to visualize the posterior hyaloid slightly better. Normally I try to avoid using triamcinolone too early on, especially if there's areas of traction because it will impair your visualization. And so as you saw there, I did induce a posterior vitreous attachment just inferiorly from the optic disc, and I continued with a more peripheral say rhexis of the posterior vitreous. And so I try to remove that neovascularization that you see there in the periphery, try to trim it down as much as possible, and continue on 360 degrees detachment of the posterior hyaloid. It's quite vital here to and imperative to make sure that one doesn't just aspirate the vitreous here because it will cause tear. It's important to continue to cut it, and with a 20K cutter that I'm using here, the retina is extremely stable. You can even direct the the opening of the cutter towards the retina, and it is very stable, doesn't really pull on it. Also, these epicenters need to be cut. And so I always end one of my final procedures is to remove the tractions or the proliferations along the vascular arcades. So I start with the periphery and work my way in. There's obviously many ways to tackle this. One could start in this posterior and continue your way out as well. And so fold back technique here with the delamination segmentation using the cutter alone. This is a one-hand technique. I do always use a chandelier just in case I wouldn't need my other hand. And you saw that I did diathermize some bleeding vessels. I generally try to be as restrictive as possible with the diathermy, as it could cause holes in the retina as well as impair the circulation somewhat. So final check, just stop some of those bleeding hemorrhages and proper laser, especially in areas where one has done diathermy. And in these cases which tend to bleed a lot, I do end the case in air. That's the end of the case. Thank you so much for watching.